Welcome everyone to the latest webinar with Dr. Philip Miller and Gotham Plastic Surgery. Today we are here to speak about the male makeover, exploring plastic surgery options for men. So from jawline contouring to a man getting a nose job or a facelift, Dr. Miller is going to break down the best path forward towards breaking free of any stigma around male plastic surgery to help men achieve their desired aesthetic goals, which they are just as able to do as women. So before we get into it, those of you that have come, we are going to do a giveaway. So please make sure that you stay on and don't leave just yet. And we will do that at the end. And everyone who joins today is also eligible for a complimentary consultation, which is great, and a $400 value right there. So you all should feel very good about coming. So before I hand this off to Dr. Miller, if you don't know him already, he's a double board certified facial plastic surgeon, and he is also a clinical associate professor at NYU School of Medicine, specializing in facial, plastic, and reconstructive surgery. He is one of the leading experts in the whole world with rhinoplasty and all types of facial rejuvenation, which includes creating these comprehensive, personalized procedure plans. And his results are very natural looking, which is something that is very refreshing to see. Dr. Miller has authored numerous textbooks pages and peer-reviewed journal articles, and his surgery center in his practice is also accredited by the Joint Commission, which is the gold standard for medical accreditation. So I could keep going on for Dr. Miller, but without further ado, let's get into it and let's learn about plastic surgery options for men.
Terrific. Thank you so very much, Risa. I appreciate it. And thank you everyone for coming this evening and learning a little bit about male plastic surgery. It's really interesting what's changed over the years, because male plastic surgery was something that you actually tried in many years, many times years ago. I'm talking around 20 years ago 30 years ago when I was still training. Male plastic surgery was something you sort of wanted to avoid. It was something like, oh, well, I don't know if they're the best patients. And it's really sad that I had that perspective growing up in terms of my medical training in this field of facial plastic surgery. But that's evolved tremendously, where all of our techniques and technologies have changed to really maximize the results we can give to men and what we can actually afford to them. And I think that men have really over the years been able to accept plastic surgery, and they've become so much more welcoming for all of the techniques and feeling more comfortable getting it and being in public, actually showing the results of their plastic surgery. So let me go ahead and just get this all started right now. Give me just a moment while I turn on the sharing mode, and I can go ahead and get this all
Perfect.
set so we can start the presentation.
And while Dr. Miller is doing that, I will just remind you guys that this is live. We're really here. It's not pre-recorded. And as I said earlier, you can ask any questions in the Q&A if you have any. You can feel free to put them in now or as we continue on, and we'll try and get to as many as we can.
Well, I think before we even start right off the bat, we want to ask ourselves, when it comes down to male plastic surgery, is really what makes a masculine looking face? What's a handsome face, right? So there's, of course, we all know there's an expert in the field, and that's, of course, who we would want to turn to today for that, and that's Google. So if we go ahead and Google in the terms, show me a handsome face, one of the things I think sort of strikes you is what unbelievably different faces we see, whether they're bearded or non-bearded, whether or not they're very younger or maybe more middle-aged, whether or not they've got high cheekbones or no cheekbones. It really is a diversity of facial features that determines whether or not you're handsome. Well, we might be able to maybe ask other questions like, is being handsome different depending upon if, a woman finds you more handsome sometimes of the month than others? And the answer is absolutely, it's true. Your handsomeness, of course, changes with a woman's cycle of the month. If you're heterosexual, a woman will find at the peak of her ovulation, at the time that she's most fertile, studies have demonstrated that women find a more rugged, masculine, sort of low brows, sort of a more brutal, if you will, kind of appearing man, right? As opposed to a more gentle appearance at other times during the month. This is a scientific study. I'm not making this up. It's really fascinating. But again, let's really go to the ultimate source these days of determining who really can figure out what makes the most manly looking man. And we all know where we have to go to from there. We have to go to ChatGPT, right? So if we go ahead and we just type into ChatGPT and say, you know what, please give us, or please tell me what makes a real handsome looking face, we know what it is. Okay, it's symmetry, it's proportions, it's the clear and healthy skin, the eyes, facial shape, but it's really not touching. Even ChatGPT didn't get it, in my opinion. You know, what really makes a handsome looking face is a handsome person who feels that they're handsome, and that's going to be totally unique. That's going to be totally dependent upon the individual, and for the individual person to feel handsome for themselves. And that's going to be unique and something that we're going to explore in your consultation with me, how I can help you make yourself feel as handsome as possible. And there are a lot of different ways that we can achieve that. Let's go over sort of the non-invasive ways. One of the ones you may have heard for quite some time is the Botox. You know, providing a Botox in order to help you with some of those wrinkles, particularly the frown lines. And those lines are the ones right between your eyes. And as you get older, I think they may be a little handsome, but they also can get a little too deep and start conveying too much age. And so we can get rid of that with Botox. And we can also treat the crow's feet. Those are on the side of the eyes. And as you smile, they get deeper and deeper as you get older. And with Botox, we can cause that to be a little less severe. The forehead lines also get more indented as we get older. And so when you raise your eyebrows, you can see them quite significantly. And with Botox, or obviously Botox in the forehead, as you raise your brows, you don't nearly need to get that depression and those significant wrinkles. We can also treat voluma as well to lift the cheeks in the cheek region, just giving a fair amount of voluma, which would be enhancement. We can change this OG curve that you're seeing there on your left to be more full, as you can see that on the right in the video. Those are typical fillers that we can do on the face. Very, very significant change, sort of a more tired look all the way on the left after treatment with both a little bit of Botox and Juvederm all the way on the right. Here's our own clay over here on the right-hand side. That's before Jeuveau. That was Jeuveau is another neuromodulator that we can give. And you can see how we were able to get rid of a lot of those depressions in his forehead, as well as the angry lines in his brow region. We can do that simply by giving him a little Botox. You know, we can make you look better in the periorbital region doing the Miller lift. That's what I call sort of the non-invasive techniques required in order to give you a more enhanced and refreshed look. We had also talked about using jaws in the upper face, but we can also do that in the mid face. The Lux is a brand new product that we have brought on the market. That Allergan has brought on the market that works wonderfully in the jawline. And you can see here before and then after, it gives you a really nice sculpted looking chin before, and it gives you that projection along the chin. The Lux is specifically made for the jawline and the chin because it provides tremendous volume and projection without moving, and a little bit goes a long way. So that's been great. But sometimes you don't want this temporary solution of the fillers. Sometimes you want a more permanent solution, and that's where we can do implants. And that's something very, very common with a number of different techniques. Let's go ahead and I'm going to show you a technique using implants to go ahead and give you volume in your cheeks. Popping out right over here. I'm going to use that string as a couplet. Now I'm going to place the retractor in the tunnel and slide the implant now into the tunnel. The guide wire is keeping it in place, and voila, you now have an augmented cheek.
The audio is really quiet now.
Oh, it is?
Yeah. Maybe you could tell us what's happening, if that's easy.
Yeah. Oh, I'm sorry. You know what? Let me just go ahead and share it one more time. And just make sure, you know what, those little buttons weren't.
Okay, perfect.
Off. Thank you. Yeah, let me go ahead and put that back on again. Thank you, Risa. Let's try that one more time. So here's the implant, the cheek implant, tied to a string that is through his mouth, through the tunnel. It's popping out right over here. I'm going to use that string as a guide. So now I'm going to place the retractor in the tunnel.
I'm going to slide the implant now into the tunnel. The guide wire is keeping it in place, and voila, we now have an augmented cheek.
That sound a little better, Risa?
Perfect.
Okay, great. Yeah. And of course, I'm actually sliding this through the mouth in order to give the enhancement of the cheek area. And this is a permanent solution. This is something where the individual doesn't need to come back every year or every year and a half or so for repeat injections. Sometimes you need a little refinement around the implant, like sort of spackling. But other than that, it's a permanent solution, lasts forever, doesn't need to be removed. And we can not only do that for the cheek, but we can also do that for the chin.
So we're putting in a chin implant today, and even though we did the virtual imaging pre-op and assessed that the patient would do best with a medium, sometimes that doesn't translate virtually into reality. And so what I do is I put incisors, and here's what it looks like. This is a medium-sized implant. That's a sizer. And that looks just about what I wanted to actually have him look like. But just to be sure, I'm going to remove this and put in a large. Okay, now this is a large, and I actually like the way this looks too, but it seems like it's a little too much. It's a little too more than what we were talking about, and I like the medium. I like the medium better. I'm gonna go ahead and put in a medium. Let's have a medium implant.
So even though I'm sort of using stock implants, medium or large, I'll always modify that. I almost always modify the implants to make sure that they fit perfectly for the individual. As you can see here on the right side, this individual over here had a poor cheek projection as well as poor sort of a retrusive chin. So he got cheek implants. He also got some jaw implants and chin implants to give him a little bit more of a square-like face. As you can see, it's sort of almost oval here pre-op, and it's much more square post-operatively. But sometimes patients don't want me to, or don't want to rely just on the off-the-shelf implants, and they're interested in getting something a little bit more detailed just for them. And that brings us to the custom implant.
Hey everyone, it's Dr. Miller here. Sometimes patients ask me to go ahead and enhance their cheeks, their chin, their jaw. Every once in a while, there's such massive asymmetry that I get asked to fix that asymmetry, not just enhance one aspect. And this was a really interesting case. It was a gentleman who had sort of a long chin on one side, a real short one on the other side. And the best way to treat that person was to create a customized implant. And we did this very interesting process of taking a three-dimensional CT scan and converting that into a scenario where we could put an implant on it and design it properly and have the patient approve it, and then 3D print the implant, not only just for the chin itself, but for the jaw. And it's sort of cool because what's great about this one is most implants that go on, they sort of fit on top of the jaw, right? Either projecting the chin or making this go out a little bit more, the side. This patient, I needed to elongate. I needed to make it longer. So there was a special groove right in here that was created to fit underneath the jaw. And so it not only projected the chin, but it made this jaw area over here longer. Really cool case.
Yeah, that was a fascinating case. But in order to give the jaw that much more definition, we want to have contrast. We want to have contrast below in the neck, and we'll talk about that soon. But we also want to have contrast above. And in order to do that, I want some definition in the cheek region. And a lot of men have a lot of fullness right in that cheek area. And again, under more or less non-invasive type techniques, we can do what's called a buccal fat removal.
All right, so we are all excited. We're going to be doing a buccal fat excision today. Buccal fat are those big pieces of fat that are near your cheeks. And they sort of protrude out and they make your face a little full. And so I have Fred here. Is that what I should call you? Fred?
Fantastic.
Okay.
You can do this under both
Fred here, who's
anesthesia.
awake. We're going to make a little incision.
Out pops the buccal fat.
And then it just pops out.
It is a buccal fat is a very specific
we have
piece
it
of
out
fat.
here,
It is not just any fat that's in the buccal region. It is a specific piece of fat, much like the yolk in an egg is a specific and discolored yellow region of an egg. You're not taking all of the egg contents out of the shell. You're just taking the yellow part out of the shell, leaving the white part behind, if you will. And in this case, we're leaving all other yellow fat behind and just taking out the dense.
That's it. 1, 2, 3. Take a look. We got the fat pockets over here. 1 and 2. Oh, that was both of those. This one might be a little smaller because it's more dehydrated. We just took this one out. This one came out first, and that one came out second. But nice big fat pockets that used to be on either side, here and here, and now he's got a nice chiseled, handsome face. It was always handsome.
More handsome.
A little bit more handsome. Exactly. All right. Thank you very much, everyone.
Well, we started with the cheeks. We're working up to the mid-face. Why don't we go straight to the nose here? The nose is a very common procedure that we do on gentlemen. We remove the bumps. We rotate the tips. We give the nose a more balanced look. You can see that on the far right over here, we can give definition of an otherwise sort of wide, bulbous tip. We can give more definition. This is a result just at 7 days. In fact, I don't think Clay would mind as the patient coordinator. For those of you who are members of the practice, you know Clay. For those of you who aren't, we welcome you to come. Clay, I did his rhinoplasty, and he was back to work a week later seeing patients. I told him to go home and get a little bit more time to rest, but he felt quite compelled to come to work. I give him a lot of credit. So you can look pretty darn good just at 7 or 8 days and be back to work. And if you are looking into rhinoplasty, you may have heard a new term called preservation rhinoplasty. And preservation rhinoplasty, well, I'll explain what that is in just a moment, but you can get really, really nice looking results in a very short period of time. And it's a way to take down the bump. I don't really love the term preservation rhinoplasty. It gives the wrong impression as to what's happening. It's really preservation dorsal technique in order to take down a hump. This explains it perhaps a little better.
Hey, everyone. There's a lot of talk right now about preservation rhinoplasty. And what does that mean? What does preservation rhinoplasty mean? Well, first of all, it's for patients who have a bump on their nose and they want to take the bump down. They want to make their nose a little smaller. Well, there are a couple of ways to do that, and I want to use this illustration to explain the 2 different ways to do it. So we'll start with this. Let's imagine that you have a really long Q-tip and you want to make it into a shorter, smaller Q-tip, right? You want to go from here down to here. Well, there's 2 ways to do that. Let's take a look at option 1. Option 1 is you break off the top of the Q-tip, right? Then you figure out how to get rid of the bottom of the Q-tip. And then you take the top Q-tip and you bring it down here. And sure enough, you've created a smaller Q-tip from a larger one, right? That's one way of taking a big bump and making it gone or smaller. You go underneath and take the stuff out and push it down. That's what preservation rhinoplasty is. The other solution, option number 2, is what's called structural. Structural is sort of the other way that we've been doing it all along. And what that is you break it down here at the height that you want it to be. But when you do that and you throw the top off, when you do that, you'll see that, well, yeah, we have the right height, but we don't have the right contour. We don't have the same configuration. So now we have to go ahead and rebuild it. We got to bring in some cotton and we got to wrap that cotton around that piece of wood. And sure enough, we have the same thing. We've gone from something large to something small. So preservation rhinoplasty is preserving that wood-cotton relationship, but destroying the bottom portion and then figuring out how to drop it down. Whereas the structural one is saying, you know what, we don't need everything on top, right? We know how tall we want it to be. Let's get rid of that stuff. But we're left with something now that doesn't really look exactly like what we want. So now let's figure out how to rebuild it. Okay, so one is preservation, one is structural. I don't know if you could argue which one is less invasive. I don't know if you could argue if any one of these is less involved. I don't know whether or not you can even say that preservation rhinoplasty really is preserving, right, the entire structure, because in both cases you're breaking it and throwing something away. But the term preservation rhinoplasty really specifically refers to the fact that you're preserving this relationship. And once you figure out how to get it down to where you want it to be, you don't have to rebuild it.
Yeah, there's just so much information right now. If you are interested in nasal work on the term preservation, I wanted to make sure people understood exactly what that meant. But there's another area that's sort of a buzz in some real interest right now, And that is, up until now, I've been talking about changes to someone's appearance using techniques that were designed specifically to change their appearance, but not necessarily make you look younger. They may make you look younger, but performing a rhinoplasty is changing your appearance, adding chin implants or cheek implants or jaw implants or doing a number of other techniques. But there's something really interesting that's a buzz right now, particularly in the male plastic surgery domain, and that is the notion of performing techniques that previously were done for aging, but now we're doing it to actually reshape the face, particularly in young individuals. This is a paper that was written by my dear friend, Mike Nyack. He's out in St. Louis, a really great guy, gets great results. I love Mike. But the notion is using the techniques that we've done in the past, specifically for aging face, like a deep neck lift, and now doing it for young patients for really facial reshaping, as opposed to just making them look younger. So here's an example of the My Elevate technique, which we use, again, for patients who are a little bit older, but in this case, we're doing it to reshape the face.
We are post-op Mondays. You know, My Elevate neck definition is not just for women. Take a look. This is a great result. Gentleman came in. He had a little bit of a retrusive chin. He had a neck that was bulging. He wanted more definition. Here he is now 3 months post-op. We went ahead and put in a chin implant. We did the submental liposuction, the My Elevate platysmoplasty, and gave him a really, really nice definition of his neck. Protruded his chin, gave him a nice masculine appearance. Now 3 months.
Yeah, he looks terrific. Now, and there's another technique called the micro lift. This is something that I designed to provide sort of enhancement of the jawline, elevation of the mid-cheek region, to give maybe even a little bit definition along the jawline as well. And it's a small incision, as you can see right here in the temple zone. And it was designed for women who were maybe a little bit older, but I'm finding that it works just as well for men when they're
Okay,
younger.
we got a micro lift in a man. Works just as well. You can lift up the entire face just by making a little incision up here and raising up this area.
Or for men who feel like there's just have too heavy brows and they want to open up their eyes a little bit, we can do eyelid surgery.
Hey everyone, it's Dr. Miller doing some male facial plastic surgery today, doing some upper eyelid. So what does that mean, upper eyelid surgery? Well, we'll take a look. I'm showing you some tissue here, just a little forewarning. You know, we all say eye bags, right? So these are the fat pockets that I go ahead and take out. That's one eye. Here's the other eye over here. And these are all the fat that needs to come out, little strip of muscle, as well as the extra skin. So that's what an upper lid blepharoplasty is.
But these techniques are just as good to rejuvenate the aging face as well. We're doing now deep plane face lifting as well as deep neck lifting in order to get rid of a significant amount of this subcutaneous tissue here, but also the deeper tissue underneath the muscles, the deep fat, the deep muscles, as well as you'll see shortly in another video, the gland, the submandibular gland as well. Now, when you're doing that work, there's always a risk of bleeding. There's a risk of bruising. This is a gentleman who's just very quick. This is, I think, within a week or two of after his surgery. So how do we go ahead and recontour this to make sure that the skin lies down nicely, it doesn't move, that we can minimize, yes, there is a little bit of bruising here, but we want to minimize his recovery as much as possible. How can we do that? And what we found is this hemostatic net. The hemostatic net is another new technique we're using, particularly in men, because men have hair on their, obviously, they've got a beard. And when you make an incision beneath that, it can be very bloody. And so we have created this new technique called hemostatic net, which works wonderfully in facelifts. I'll show you what that means.
You may have been hearing about this thing called a hemostatic net or a surgical net, which is what this is, right? I mean, here's a post-op patient and they've got sutures sort of going all around their face. What is that? What's going on? Well, you have to start sort of like this. If someone comes in and they've got a really big neck or a really big face, and I have to do a facelift on them, I'm raising a lot of skin and then putting it back down. And just like you have a lot of down in a down comforter, and in order to make sure that all the down sort of sits exactly where you want it to be, you quilt it. Well, that's what this is. We're sort of quilting temporarily, just for a few days. We're quilting the skin superficially to deep to keep everything nice and fixed in one location. And then after around 3 days, we remove them. It doesn't leave any scars whatsoever. I can't wait to show you this gentleman's results in a few days. But that's what a hemostatic net is. That's what a surgical net is. That's what this crazy kind of thing is that you may be seeing all over the internet is. And that's why we do it.
So you do something like a deep neck lift, and you can get amazing results. This is a gentleman, we were able to bring him from here to here by doing a deep plane facelift, a deep neck lift, applying that hemostatic net, getting that out. And this is him around, I think, 2 or 3 months later. Once again, if you didn't catch exactly what that net is,
into the deep tissue and then they come back out, you can sort of see it's pleated in a quilt-like fashion like that. And that's to make sure all the skin stays down exactly where I want it to create a really beautiful kind of jawline, neckline here. And then today we're just going to take all those out. We're not taking the incision sutures out, but we'll take all these others out.
And why is this important? Because we're going deeper in the neck, we're taking more tissue out. And I had mentioned before, we're taking deep fat, we're taking some muscles out, we're reconnecting some muscles, or we're doing something else, we're taking something else out.
From here to here. Well, it's a technique called a deep neck lift. This is very different than the old-fashioned neck lifts, which were more superficial in nature. A little liposuction didn't get the underlying deep fat. This neck lift now not only separates the first layer of muscle to remove the deeper fat tissue, okay, but it also takes those muscles and repositions them and tacks them up and lifts them in order to create a really nice jawline. But there's something else. There's something that this patient doesn't have that they had before, and that's their submandibular gland. Now, the gland itself sits often tucked up underneath the jawline, but as we get older, it sort of falls down. It might even get a little big. And now when you do this, when we used to do the old-fashioned neck lifts, it looked good, but they had a bulge right over here and a bulge right over here. And that bulge was the submandibular gland. Now we take those out as part of the deep neck lift. It's okay, you have other glands in your face and in your mouth that produce saliva, so you don't necessarily need it. And not everybody does this operation because there are some nerves and some vessels that are nearby that have to be gingerly and carefully sort of pushed away as you take the gland out. But it is making necks now look terrific, absolutely great. So I hope this explains to you what a new deep neck lift is, how to get it, and the kind of results that you can get.
Working our way up still further, we get to the hair. And, I don't do hair transplants. I can refer you to some amazing people in New York City, as well as down in Miami and elsewhere in New Orleans, who do phenomenal hair restoration. But if you want something non-invasive, something quick, Jen does this for my male patients. That's a PRF. It's a sort of a version of platelet-rich plasma, but this is platelet-rich fibrin, and it's an amazing treatment. Injections into the hair losing regions, and you can get hair restoration. So I went through this fast. I know. I hope that you enjoyed this multimedia type of presentation, both in terms of what I was able to convey, but also a little bit of a unabashed promotion of my social media, because I really love teaching and I really love explaining things to patients. So I presented within this presentation a whole bunch of little video shorts that I do on a pretty frequent basis. Shout out to April, to Adina, to Clay, to Tanya, to Jose, to Zane, everyone in the office who helps me put this all together, to Carmen as well, to Jen, everyone, thank you so much for helping me put this together. So feel free to connect with us on Instagram, on TikTok, Facebook, whatever, so that you can see these. And if you enjoyed tonight's webinar, please join me for the next one. That'll be Tuesday, July 25th at 6 o'clock. And I think it's on maybe just, we're revisiting
Rhinoplasty.
It is rhinoplasty. Yeah, we had a fair amount of interest in that. So we're going to do that once again. And with that, I'm going to stop the share. Risa,
Thank you. All right, guys, don't leave. We still have some good stuff left. First, we're open for question and answer right now. So this is your opportunity to ask Dr. Miller anything. You can ask the question anonymously.
I do. As I told you, Risa, unfortunately, I have to bolt out of here a little early tonight, so I won't be able to spend that much time. But I promise anything that's left over that I don't answer tonight, I'm going to answer on TikTok or on Instagram or something like that. So we will be answering all of the questions.
Thank you. Okay, so questions you guys can pop into the Q&A feature on Zoom right now. And then as soon as we get done with that, we will announce the winners. But I do want to make sure that you guys got that date. So it's July 25th at 6 p.m. Eastern, and we're going to be talking about the latest secrets in rhinoplasty advances. All right, so let's see. First question.
Yes.
Let's see. For dark under eye circles, would you suggest a lower blepharoplasty, or are there other options?
A great question. So, when it comes to dark circles, I always like to say, what, before I tell you about the solution, let me explain what the problem is. And dark circles under the eyes it occurs because of one of three reasons. One of them is that you get really bad pigment under the area. The second reason is that just like you've got the dark spots in the moon because of the craters, likewise, the under eyes sometimes have concavities, and those concavities themselves just appear darker relative to other portions of the face. And then finally, you can also get shadows, and those shadows are because there's bulge right above those areas that appear dark. So working from the beginning, in the areas that are hyperpigmented or really dark, we recommend lightening cream or maybe a laser resurfacing. For those areas that appear a little depressed, we want to fill them out, and we can do that either just by using filler off the shelf and just grabbing some injections, or we can use your own fat harvested. My preference is the inner knee. We just take a little bit of fat from the inner knee and inject it underneath the eye. And then finally, if there is a bulge above the depression, above the dark area, we'll go ahead, as I showed on the video tonight, we take that fat out, and often we'll do a combination of those three treatments in order to give you the best appearing eyes possible.
All right, so it sounds like you need to set up a consultation because it's very customized treatment, as is everything we offer. All right, here's another good question. Do lip reductions for symmetry or otherwise differ for a man versus a woman?
Not really, I would say. And I'll tell you why, primarily because when it comes to lips, there's such a really impressive myriad and such differences in configuration and anatomy that it just changes so much from person to person. I would say that for the most part, we're not going to raise the lip as high in a man as a woman, because we don't want a man to have as pouty appearing upper lip as a woman may want to have. But other than that, there's just so much variables when it comes to the configuration and shape of a lip in general, that you may find that, I show you lips, you may find that you don't necessarily know if it's a male lip or a female lip.
Got it. Okay. What's the average waiting list for an in-person consultation?
That's a good question. I don't know.
That is, I'm looking it up right now on the website.
And I'll tell you why, because one of them is, number one is I would just say give a call, because a lot of times, sad or unfortunately, some patients have to cancel last minute. And so we do get openings every once in a while. And so there are times when I realize that, I don't like it I don't want my patients waiting too long to get a consultation. So worst case scenario, we'll open some days earlier, so that the days that I wasn't seeing patients, we can see earlier, or sometimes if surgery gets canceled, we'll open up some time slots rather than have patients wait for a consultation.
And I think I saw that you did that this week, because there was one slot open this week. So I'll shoot the link over here to this person right now. You can try and grab it. And everyone on this, actually, I may have sent, yes. Okay, reduced fee. Yes. Everyone on this, you obviously are eligible for a complimentary consultation as well.
Yes.
Okay, we have a few more minutes. We'll get to as many as we can. Are there any non-surgical procedures for the lower eyelids?
Are there any non-surgical procedures for the lower eyelids? Absolutely. Absolutely. Again, it depends upon what the problem is. So let's quickly go over them. You can have some loose skin. The loose skin can be treated by either a peel, a chemical peel, or it can be treated with a laser peel, both of which are applying energy to the skin, and the skin responds to being injured in either way by trying to heal itself, and in the process of healing itself, it actually contracts. So that's one solution for lower eyelid. Another problem that we have for lower eyelids is the depressions, as I mentioned earlier, and we can fill those depressions either with fillers that we take off the shelf and you come in and I can do it on the same day, or if you want a longer term, longer lasting solution, we can harvest some fat from the inside of your knee and place that along the inferior or on the bottom portion of your eyelid. And then finally, we already talked about discoloration as well.
Perfect. All right. So in general, what is the biggest difference between how you approach a man versus a woman for plastic surgery?
Yeah, I would say that it has to do with facial shape. In a woman, you're looking more for a heart-like shape, right? Because we're really getting into this interesting new domain of really doing facial shaping. I mean, I think we were looking at a face for years. It's really fascinating. I think that if you really go back around 30 years ago, you know, the surgeons were sort of saying, okay, as you get older, your face drops, or we're going to lift it. And the dermatologists were looking at it going, oh, look at all these wrinkles. I'm going to take collagen and I'm going to just inject it into these little wrinkles. And we were sort of looking at things too, sort of macroscopically, and they were looking at things too microscopically. And then new fillers came on the market, and all of a sudden people started looking at the face and saying, wait a second, it's not just descent and it's not just wrinkles. Maybe there's a volume issue here. Maybe we have to start putting volume into different portions of the face to make them look more rejuvenated. And then the dermatologists looked at it using certain types of filler. We as facial plastic surgeons started doing it with fat injections and by moving different tissue pads. And now we're looking at everything going, wait a second here, this is really facial reshaping. That's what we're really doing here. It's not just about aging, it's about facial reshaping. And so the woman's face tends to be sort of a heart-like shape, and a man's face tends to want to be more like boxy. You want to have a stronger jawline, a higher elevation of your hyoid region, both of which can be done with a deep neck lift. The brows in a man don't have to be really high elevated. It's okay for them to be a little lower, but you don't want that hanging upper lid skin. The cheeks are the most interesting because women tend to want more robust cheeks, but it really depends. There are certain male models that I have, and I truly mean not trying to look like a male model. There are very well-known male models who are relatively flat right here, and I do not augment them at all. That's their look. It is a look. I think they look terrific personally, but I don't add anything here or even on their cheek region. Whereas if a woman came in, they definitely need some volume in that particular region. So there are just some of the simple differences.
Got it. That's really helpful to hear. And I know we're cutting on time. So at this time, I think we should go ahead and pick our winners. And if anyone else has...
And I apologize. Usually I can do another 50 minutes. I can't tonight, but I promise to answer all those questions. I promise that we'll have April and I are going to do those at another time.
Perfect. So make sure you're following Dr. Miller on social media. You can always DM a question there if it's easier. But all right, we have 3 lucky attendees that are going to win $500 credit towards your surgery. So let me put this through a real random sorter here. And the first one is Matthew J. Matthew J.
Congratulations.
Congratulations. The next one is Adrian T.
Congratulations, Adrian T.
Yeah, we look forward to seeing you. And last but definitely not least, we have Ryan L.
Excellent.
So,
You know Ryan.
ooh, okay, maybe you will. Anyway, so, but everyone else, if you didn't win, you still are a winner because you get $400 off a consultation, which is basically a complimentary consultation. So I think there should be no reason why you shouldn't get some one-on-one time with Dr. Miller. He is incredible. It's really amazing to let him just analyze your face and give you some feedback and answer some of your concerns. And whether you decide to proceed with treatment or not, I think it's always best to know your options and to hear them from someone who can, speak the authentic truth. So With that in mind, please make sure you mark your calendars. July 25th, we're going to go deep into rhinoplasties, which is a very big area of expertise that Dr. Miller is known for. And otherwise, I thank Dr. Miller so much for taking the time after a busy day of surgery to educate us all.
I love it. I love this. I love it. And Risha, thank you. You always make this so easy and so simple, and you're the best. Thank you for coordinating this. Thank you for sort of moderating it and answering or asking all those questions and compiling everything for us. So thank you.
And of course, most importantly, to all of you that came to attend, I really hope this was valuable for you. I hope you learned a lot. And this was recorded, as you know. We will send out the recording shortly, and I encourage you to forward this to any family, friends who may benefit from the education. So thank you so much. Have a good rest of your evening, and we'll see you again on social media. Bye.
Bye-bye, everyone.